All of a sudden, I had anxiety and panic attacks that I never had before. Then my hair started falling out. Then I had acid reflux, and then I had joint pain. It's not normal for you to have a stomach ache. It's not normal for you to have constipation or diarrhea. I got diagnosed with IBS after some really unpleasant symptoms.
What are the root causes that you see in your practice of IBS that actually heal IBS?
You might have like brain fog, you might have fatigue, skin breakouts, bloating, acid reflux, pain in your body from these foods. Taking some thiamine could actually reverse that. People who are eating a carnivore diet, what's going on? Why can't their bodies break down plant foods? There is a research paper by Dr. Haba who mentioned in studying 303 people with IBS, 98% of them had a treatable cause.
And what about the 3 worst food additives for the health of your gut? Hi everyone. What if that bloating, that after meal bloat, the food baby, the gas or the reflux, what if it had a deeper story to tell, some wisdom to share? So rather than putting IBS and like digestive issues into a wastebasket diagnosis like IBS, like was done for me, like was done for Dr. Isabella, what if we can learn our precise triggers, our underlying concerns, and actually heal from the root? That's what today's conversation is going to be about with a dear friend of mine, Dr. Isabella Wentz. She is basically a legend in the functional medicine space when it comes to the health of the thyroid. One of the underlying issues of autoimmunity and thyroid issues is IBS, is something, and this is on the rise. So Dr. Isabella Wentz, I'm really, really excited to have you here. This book is a game changer. I hope everyone goes out to get it. We're gonna just scratch the surface, but it's gonna be full of impactful information. So thank you for coming on the show, Isabella.
Autumn, thank you so much for having me. It's just always such a joy and pleasure to be around you.
Likewise, we have way too much fun, and I just love to pick your brain because there's so much in there, and you've done this for so long, and you've worked with, I don't know, thousands. How many people have you actually worked with?
I mean, it's been thousands at this point.
Yeah, so we're gonna start with some rapid fire questions, just to give you guys a taste of what's to come, what we're gonna really unpack. The first one being, what's the one or two foods you see a lot of people eating that is quietly destroying their gut health?
Gluten, and then also raw vegetables.
Ooh, we are going to unpack that. I know I have a large carnivore presence, and so they are feeling that response, and we'll get into why and how we, or if we try to get out of that. Second is, what is the biggest lie people are told about their digestive health?
They're told that their digestive symptoms are normal. They're common, but they're not normal. So it's not normal for you to have a stomach ache. It's not normal for you to have constipation or diarrhea.
I love it. And what about the 3 worst food additives? This is a big topic today for the health of your gut.
Sugar alcohols like sorbitol and erythritol are 2 of my least favorite, and then also like carrageenan.
Okay, and I've heard you talk about soy lecithin too.
That one's evil too. That was a personal trigger for me.
Absolutely. Okay, so best natural bloating remedy that works quickly.
Digestive enzymes.
What about peppermint oil? That's something I've used with pretty great results. Does that work for you
I
too?
love peppermint oil and peppermint tea and ginger tea. These are all fabulous remedies.
Perfect. What about the most overrated gut health tip?
Gosh, probiotics. Low FODMAP diet, all the way.
Love it. Okay, and last one. What's something most doctors completely miss when it comes to diagnosing IBS?
Most of them completely miss parasites. So they just don't even think about parasites. They're not even on their radar when they're such an important driver.
Yes, and something I learned about that I think probably directly applies to me that I haven't heard a lot of people talk about, nickel sensitivity.
Yeah.
How do you see that pretty commonly in people? I just want to put that on people's radar too. I found that to be a fascinating part of your book.
Yeah, nickel sensitivity is an underappreciated cause of IBS. And this is something that people can get from exposure to like their cutlery and silverware and specific foods.
Yeah, we'll talk more about that because I'm the person who used to break out when I would wear the not real earrings, the nickel-based earrings. So I think that my mom and my sister probably have some semblance of that too. So, and a lot of other people listening. So, okay, now you didn't just write a book about IBS. As I alluded to earlier, you lived the IBS story. So can you tell us, Dr. Wentz, what inspired you to write this book? What's your story? How'd you get here?
So I started to have digestive symptoms during pharmacy school. I got diagnosed with IBS after some really unpleasant symptoms where I had to essentially keep running back and forth to the bathroom. These symptoms would flare up in the middle of the night. They would flare up during class. They would flare up on outings with friends. during exams, I actually had to miss an exam because of having to be in the bathroom. I didn't really take it seriously. I kind of maybe cut out a couple of foods. I thought, okay, soy lecithin might be a trigger for me, but I'll just kind of take some meds and I'll carry Imodium with me and baby wipes and extra pants everywhere I go. Just kind of learn to live with it. And then as time went on, I started to get more symptoms. All of a sudden, I had anxiety and panic attacks that I never had before. Then my hair started falling out. Then I had acid reflux, and then I had joint pain. And at a certain point, I got this diagnosis of Hashimoto's thyroiditis, which I'm known for thyroid illness and Hashimoto's. Once I got that diagnosis, I was like, okay, what am I doing here? Why am I in my 20s? Why is my body falling apart? Like, I need to figure this out. And so by trying to get my Hashimoto's into remission, I actually got my IBS and acid reflux into remission first and second, I should say. For many years, I've worked with Hashimoto's patients to try to get them into remission, and big part of the work that I've done with them is working on their gut health. And I finally decided to write this IBS book because I've learned so much about gut health and I've learned about so many different triggers for IBS. My hope is to help people reverse their digestive symptoms, potentially reverse their anxiety, depression, their mood issues, reverse their autoimmunity, and potentially prevent autoimmunity if they don't have it yet. Because we do know that there is this like ticking time bomb once you have a disruption of the gut barrier. And some people might get an IBS diagnosis when this happens, others might not. They might just have like a food poisoning situation. There's a countdown to when you start having an autoimmune diagnosis and these autoimmune symptoms start developing. So my hope is to help people heal from all of that.
I love that. And like you said, I can't remember a few years ago when they discussed like genetics, environmental trigger, gut permeability when it comes to autoimmunity, and that they all kind of work together. And that was my story too. I went and had IBS, and I can tell you, at least back then, they didn't have a lot to offer me. It was like, here's some Beano, you have a stress-based condition, and then just good luck. And I was like, oh wow. So I feel really fortunate that I was able to figure out through food and other digestive supplements, how to heal that, because I have no doubt I was headed towards an autoimmune illness. So let's start at the top. When people go in and they get an IBS diagnosis, what does that mean really? How is it conventionally diagnosed? And maybe what are the shortcomings with that approach?
It's a diagnosis that's based on symptoms and on patient-reported symptoms. So essentially you're like, I've been having constipation and or diarrhea, one or the other, or a mixture of both for quite some time now. And I'm also having abdominal pain, maybe some bloating, maybe some pain with defecation or some straining with defecation. And that's kind of it. You tell the doctor your symptoms and they're like, congratulations, you have IBS, right? And your symptoms have to be going on for sometimes 3 to 6 months, and they have to be chronic. So it's not like you had diarrhea once and you get the IBS label. But the tricky part about it is that the label describes the symptoms to us really well, right? It's like your bowels are irritable, right? Like your digestion is off, but it doesn't really tell us why. And we have to know why in order to really know what to do about it. And so conventional medicine just says, okay, you've got this cluster of symptoms. We're going to label it IBS. And here's a bunch of stuff to try that has less than 25% efficacy rate. Good luck with that.
Yeah. So if we step back and look at how it should be, then, so for a lot of people, IBS isn't like the answer. It's just the beginning of an exploration is what I think the approach that you're kind of alluding to, not just good luck, here's some Beano, but hey, what can we learn from this? So tell us, what are the root causes that you see in your practice of IBS that actually heal IBS?
There are a lot of root causes, and I have done a lot of research on what they might be. There are some that I've personally seen, and there are some that are out there in research, and they don't necessarily overlap, if that makes sense. Like there is a research paper by Dr. Haba who mentioned in studying 303 people with IBS, 98% of them had a treatable cause. And so it was,
wow.
It was like 1 of 5 things that he found was an issue for people with IBS. And celiac disease, bile acid malabsorption were some of the causes. I have seen other causes like pancreatic enzyme deficiencies can be a cause. I have seen protozoal infections to be a cause. Celiac disease is documented to be a cause in up to 25% of people with IBS. In my experience, it could also be gluten sensitivity It could be dairy sensitivity. People with toxicity from mold, they can have IBS symptoms. Hormonal imbalances, especially like female hormone imbalances, can lead to constipation. Stress hormone imbalances. We can have thyroid hormone imbalances. A person who is hypothyroid might have constipation. A person who has an overactive thyroid might have diarrhea. Let's see what else. SIBO, small intestinal bacterial overgrowth. This is going to be an important root cause. And really like enzyme deficiencies, any kind of enzyme deficiency, nutrient deficiencies too. These can be important common causes. Food additives can be causes of IBS. Medications. Not a lot of people like realize that medications can be causative. Absolutely the root cause of IBS. Birth control pills, specifically the drospirenone containing birth control pills. Some of the popular brand names back in my day when I was a dispensing pharmacist were Yaz and Yasmin. They've been studied to actually induce IBS. There's opiate medications that can slow down motility. Some of the GLP-1s that are super popular these days, they can also slow down motility. You know, there's a lot of different things. When I was in pharmacy school, the joke was like, if you don't know a drug's side effect on a multiple choice test, just always pick digestive issues because like there's a good chance that's going to be like the answer.
Oh my gosh. And yeah, I didn't even say it in the intro, but that is your trade. You are a pharmacist. So that is fascinating. Okay. So you said GLP-1s. I have to kind of say, what is your stance on GLP-1s? I know maybe they lead to digestive issues. I know stomach paralysis. What do you think? Do you think they're a good idea? Are they a bad idea because of the digestive issues? Do you have concerns around GLP-1s?
I think microdosed, I have seen them help a lot of people with autoimmunity and inflammatory conditions, blood sugar issues, even things like being dependent on alcohol and just like that food noise. So I think they can definitely be beneficial. As a pharmacist, I'm sort of like, okay, no drug is evil, right? It's like always about the right drug for the right person at the right time and the right dose. And the same goes for GLP-1s. And I will add to it, like if you are not living a healthy lifestyle, if you're not focusing on muscle training and you're just eating crappy food and taking a GLP-1, that's different than if you are focusing on a healthy lifestyle, building up your muscle, supporting your digestion, supporting your movement, nourishing your body with healthy food and supplements, and utilizing a low dose of GLP-1. Like you're going to get completely different outcomes, right? So one is leading towards health and another one can be like, okay, I'm trying to lose weight, I'm trying to shrink, but also I'm giving myself digestive issues and wasting my muscle, right?
Yeah, absolutely. And I've heard a lot of, I don't know if this was like breaking news in your social media feed, but this link between B1, vitamin B1 and IBS. Have you seen that? Can you talk about that a little bit? I thought that was interesting.
Yeah, it's been fascinating. So this has kind of been a new on the radar that they've connected thiamine with IBS. I have been seeing it for quite some time. I would say it's very fascinating because diarrhea can actually make us B1 deficient. And I have seen a lot of my clients with, I would say like acid reflux, low stomach acid, IBS, chronic fatigue, thyroid issues, like digestive issues, low blood pressure, and then we'll put them on thiamine, benfotiamine specifically, and it's like very precise, 600 milligrams. And a lot of their symptoms just turn around in about 3 to 5 days. It's been really, really incredible. And on the flip side of that, like thiamine can help with like GI motility. So some people with constipation, they actually can really benefit from thiamine too. There are some, Elliot Overton is like the world's top thiamine expert, in my opinion. He's like this brilliant nutritionist. He's British but living in France, and he actually talks about how in some cases SIBO can be a thiamine deficiency, and getting thiamine restored can really help with that gastric motility. In my experience, I've put a lot of people on betaine with pepsin over the time to support their protein digestion, and a lot of them I've been able to wean off of that with proper thiamine dosing. So it does tend to support digestion in a really fascinating, kind of like a prokinetic, but also just like a mitochondrial stimulant, and just sort of fills in whatever we're missing. It can be very helpful for a lot of conditions.
Yeah. One of my root causes was definitely low stomach acid, but I don't tolerate carbohydrates well. And I know that's another kind of sign that I might have like a thiamine imbalance or deficiency. So what do you
Yes.
think about that? Yeah?
Definitely. That was also my observation in people who would maybe get like brain fog from carbohydrates or a lot of blood sugar swings. Taking some thiamine could actually reverse that. And it's very interesting because there is a therapeutic dose of thiamine that I will use that's way beyond the RDA. So the RDA might be like milligrams, where we're using mega doses of thiamine. There are a few different types of thiamine. There's straight up thiamine, there's injectable thiamine, there's sylbuthiamine, which tends to be more brain active. My one of choice has been benfotiamine for a lot of people, and it's more of a fat soluble thiamine derivative. And yeah, blood sugar issues, a lot of these like carb issues really improve. For me, it's like I've gotten hugs from random people at conferences where like I've been like on disability and I had the worst fatigue for years, and I started to take thiamine, and within days I felt more energy, and after months like I've been fully recovered. And sometimes I wish everybody was this easy, but sometimes it is like this powerful nutrient that can turn things around for people.
Yeah, and what are the best dietary sources? I know pork is one of them.
The tricky thing, again, it's like the RDA of thiamine, and what you would get from foods is going to be like 1.2 milligrams
Different.
per day, right, for men,
Yep.
and then 1.4 milligrams for women, where I'm using like 600 milligrams. And so
Okay.
it's going to be tricky to get that from food. I will say, if you are on a grain-free diet or a gluten-free diet and a low processed food diet, there's a chance that you're deficient. And it's sort of like, because thiamine can be added to some foods to be like, it's fortified, it's like sometimes, you know, we're doing everything to be healthier, but also we can become nutrient deficient on our healing journey. The other interesting thing is like, you can't really test for thiamine deficiency. The tests out there, they look for alcohol-induced thiamine deficiency, which is like a really serious condition. When I was going through pharmacy school, you learn about like these conditions where people present with like delirium and like really serious issues because of thiamine deficiency. And that's not the clinical presentation that I see in people with like this subclinical deficiency, I guess, for lack of a better word.
I love that. Yeah, thank you. Just like you said, the dose, but just if you want to try to get it every day, you know, pork, nuts, seeds, these are probably really low levels, right? But eggs, trout, potatoes. But yes, supplementation might be necessary. And I think I should probably start experimenting with that. I always like to do dietary stuff first, but there seems to be a good case for, I'm just gonna at least have to try that. My other two things before we touch on testing and how do we kind of like start to uncover our root causes or our post-infectious IBS, I think that's interesting, and also bile acid insufficiency. So can you talk about what we might be dealing with there and how we would know those might apply to us?
So, post-infectious IBS, this is kind of tricky because the current science and the literature talks about you get some kind of an infection, maybe it's viral, maybe it's bacterial, maybe it's protozoal. You clear the infection isn't there anymore, but you're still having symptoms. It's because the infection shifted something. Well, when I do functional medicine testing, guess what? The infection's still there. So I'll see viral pathogens on like a GI map or a gut zoomer that are there months, sometimes years after somebody has had like the stomach flu or norovirus, where, you know, the conventional medical wisdom would say that these have cleared, these were in your body and you don't have them anymore. Same with a parasite like Giardia or blasto. So somebody might have, you know, like dysentery where they're traveling and they're exposed to something and they get food poisoning. They might take like anti-protozoal medications or antibiotics and they think they've cleared it, or they think like their body doesn't have that acute, like, you know, like have watery diarrhea for 3 days, but that I don't have that anymore. And they think that they no longer have that infection. But again, I'll do stool tests and I'll be like, there it is. There's that infection. You've probably had it since that retreat in India where you got that initial food poisoning and then your health started to decline. I would say like from a functional medicine standpoint, it kind of goes against the research and against the conventional mind work of like post-infectious IBS happens because you once had an infection and your immune system is just crazy. I haven't seen the evidence of that. The evidence that I see is you had an infection and guess what? It's still there. And so we need to treat that infection and that will help to get your immune system balanced again when the infection's not there anymore.
Yeah, and so you mentioned parasites, not on the radar of most doctors. So which parasites are you often seeing tied to IBS?
The one that's been studied the most is Blastocystis hominis, and it may be present in up to 70% of people with IBS, depending on the study that's been done. Ton of research connecting it to irritable bowel syndrome, connecting it to chronic hives, colitis, chronic urticaria, and also some emerging research connecting it to Hashimoto's. In my experience, I have seen treating this can get rid of IBS symptoms. It can get rid of a lot of food sensitivities. It can get rid of the chronic hives. It can get rid of diarrhea, reduce thyroid antibodies. Some people go into remission from Hashimoto's. And then Giardia is the other one that's been widely studied. Some people call it beaver fever, not to be mistaken with the singer Justin Bieber. It is something that can be, picked up from like hikes or still water where you have water that's not moving. It tends to live in those kind of areas. If you have pets, let's be real, our pets are kind of disgusting and they can get into everything, right? I've had a beautiful dog that he would eat poop. If he was given the opportunity, he would eat poop, right? Like my mom's Pomeranian, they live in Chicago and they had this beautiful backyard that was covered in snow and there was like bunnies pooping, right, in the snow. And she would like run full force and like just with her mouth open and like eat the frozen delicacies of bunny poop, right? And so those beautiful pets, they get in our beds and they give us beautiful kisses on our mouth sometimes. And that is another way that we can pick up these parasites. And Giardia in particular, I have seen pets have that and they can give it to us. Those are the two that have been most studied. I have seen a bunch of other ones as well. Entomoeba histolytica, Endolimax nana, Dientomoeba fragilis. A lot of protozoan parasites is what I typically will see. So it's not something that, you go to a bowel movement and then you have like a dragon in your stools that's like staring at you or anything like that.
Not like that.
Not like that. It's like something you would see like under a microscope. Like you would not be able to see it with the naked eye. You do need like stool testing for it. And unfortunately, like the parasite cleanses that are like all the rage, they might help one parasite, but not another. So something to consider.
Yeah, and so you probably do offer in Rootcology, which is the supplements you've made. Do you have like a parasite cleanse?
I actually don't have a parasite cleanse. I am a big proponent of like test, don't guess with that because sometimes you can take a medication for 3 days and get rid of an infection. Like Giardia, you can take like 3 days of a medication and it's gone, or a 1-day medication and it's gone. Or you can do like a 90-day herbal protocol and there's like an 80% chance that it'll go away. And I'm like, okay, why not just take the medication? It's got very few side effects and 1 dose and you're done. I do have berberine and oil of oregano, and then I do have black cumin seed and black seed oil. These do have anti-parasitic properties.
Yeah.
So you can utilize them for some infections, or if you're trying to do like a broad spectrum gut cleanse or gut protocol, I talk about how to utilize those in the book. Generally speaking, it's like a 30 to 60 day protocol where you would want to utilize these.
Yeah. You know what? Berberine, I love berberine because I have like high-ish cholesterol, but nothing I'm really worried about. So I bring that in every few months, but I also know it has gut benefits. So I'm kind of like, I use it as kind of like my yearly cleanse. I know it's non-specific, but I don't have symptoms right now. So I just consider it both. Last one on these bugs. What about H. pylori? Do you see that as a major factor in a lot of IBS or not really?
Absolutely. So H. pylori is very interesting because what it can do is it can suppress our stomach acid and it can cause acid reflux, which a lot of people with IBS have. Something like 80%, right, will have both acid reflux and IBS. The other thing it does, because it suppresses our stomach acid, that means we're not going to be digesting our foods as well. And so we end up with more food sensitivities. We can end up with constipation because we're not digesting our foods properly. We can end up with diarrhea. We can actually end up with parasites or other kinds of infections because when we have enough stomach acid, that helps us like cleanse the food, right? Because there's microbes everywhere. We're eating sushi. There might be some sketchy organism on the sushi. If we have enough stomach acid, the stomach acid is going to kill off the sketchy organism. If we don't, that sketchy organism can get into our system. And then also SIBO. So SIBO is a condition of small intestinal bacterial overgrowth that's been found anywhere from like 30 to 70% of people with IBS might have this. There are reasons why we get SIBO. One of them is when we have an underactive thyroid. Another one is when we don't have enough stomach acid. So H. pylori, it can cause thyroid issues and it could also cause low stomach acid leading to SIBO. So it's like one of those bacteria that essentially sets up a perfect storm for a person to get IBS.
And I know it's a little bit more tricky sometimes. Sometimes you have to try many different remedies, like Matula tea, or you know what I mean? But I don't know if you have any thoughts on like what a good approach to H. pylori would be in a nutshell. I know you don't have time, but do you see any super successful secrets when it comes to H. pylori eradication?
I think DGL and mastic gum worked pretty well for like a 60-day protocol back in the day. And then the pandemic kind of changed things. I don't know, like I just started to see a lot more resistant strains. And the microbiome lab has some interesting H. pylori probiotics that can be helpful that help the body eradicate that. Black seed oil is another one of my favorites, or black cumin seed. It's effective for everything except death, I think the official quote is. But also like cranberry juice that can help prevent adhesion of H. pylori. I also find that sometimes it can be passed back and forth between partners. So your husband has it and you have it and he might be asymptomatic and you're treating yourself, but it's like a bacteria. So it's like it can just like keep coming back if you keep getting exposed. And then the other thing is like not treating the mouth, so you can have a reservoir of it in your mouth, and your toothbrush. Your toothbrush can be a reservoir for it. So when I put people on H. pylori protocols, I'm like, okay, put yourself a timer in your calendar that every Monday you're gonna get a new toothbrush. Like we're gonna sacrifice a lot of toothbrushes because you're just could be basically like killing something and then brushing your teeth and putting it back on.
Reinfecting yourself. Okay, those are beautiful tips. Now, we're going to get to food in a second because I think in your book, you painted the picture that food is a big trigger for so many people, a big way to discover what's actually underlying your issues. And we'll talk about how to optimize digestion. But first, you get an IBS diagnosis. We're talking about finding the root cause. What are the tests? What are the steps that we would take to uncover our root cause?
Definitely, you can start with food and figure out which foods are triggering for you would be great, and that can actually inform you of what your root cause might be. Gluten and dairy are some of the more common reactive foods, and then we're looking at like if you're reacting to fatty foods, there's a chance you might have deficiencies in bile or pancreatic enzymes. You can test stool tests and see if you have like low fecal elastase under 500. That could indicate that you might benefit from pancreatic enzymes. If you have issues with digesting fiber and raw vegetables, oftentimes that might be related to like a dysbiosis in your gut, so you might not have enough of these beneficial microbes. If you have issues with oxalates, you might have a candida or a mold colonization. If you have issues with like histamines, there's a chance you might have SIBO, dysbiosis, potentially a protozoal infection or a mold colonization. And then if you have issues with like the FODMAP foods, that's usually classical for SIBO. So these fermentable oligosaccharides, so like let's say Jerusalem artichokes or onions, like actually a lot of really great foods. The way that I would approach this for people is like really getting an inventory of like what foods are causing you symptoms, tying it back to that. And then I do have I kind of have probably like 5 functional medicine tests that I like to use. If everybody had like $1 million, I would be like, let's do these tests. They're amazing. And I mean, they're actually not that expensive. They're less expensive than trying all the wrong things for years on end, for sure.
I love that approach. Yes, and we're going to get into the food in a second, but what are some of the tests? Because I know there's a lot of controversy around IgG testing. Is it valid? Is it helpful? And I will say, I know that research isn't maybe robust and it's not always consistent, but it has really helped me identify garlic as a trigger, right? And then most recently that the coffee I was drinking was not working for me at that time. And I know they shift, but yeah, tell us the major tests. I know, like you said, celiac disease and IBD. These are often misdiagnosed. So high level, what are the tests? If you're gonna just go for it, what would you recommend?
If you've done like the gastroenterologist route and you've had things like inflammatory bowel disease and celiac disease ruled out, maybe you had, GI bleeding or weight loss or a diagnosis after the age of 50 or symptoms starting after the age of 50, like this would be an indication that you go see a GI doctor, do a colonoscopy, make sure it's not something like colorectal cancer or inflammatory bowel disease, and definitely get tested for celiac disease if you're eating gluten. If you're not eating gluten, then the celiac test might be actually inconclusive the way that it's done. So you could do some blood testing to figure out if you have the genetic predisposition, but not everybody with that predisposition is going to get celiac disease. And then there are some genes that might be different, like you might still have celiac disease even if you don't have those specific genes, or you still might be gluten sensitive. So that's kind of like the conventional route. With regard to the functional medicine root cause approach, there are IgG tests on the market, a lot of different food sensitivity tests out there. They're considered controversial and experimental, and I agree with that consideration because there's so many different tests out there. they're not standardized, and every different lab can use a different methodology. Some of them might use cooked foods, some of them might use raw foods, some of them might use different assays to produce different results. They might look at the IgG component, they might look at IgG4, they might look at like IgA reactions, and there's like different parts of the immune system they can look at. Some of them make you be off of the foods, some of them make you be on the foods. And it's just like, I've looked at a lot of these over the years where people were like, I did this test and I eliminated the foods, I feel nothing, or I feel worse, right? And there's one test that I have done over and over. I don't know how many tests now. I've done it on myself, like pretty much every year for the last 13 years, on family members and a lot of clients, probably 800 tests by now. And it's all a test, IgG test, where I can correlate it. I could say, oh, ginger came up as a reactive food for you. And they would remove ginger from their diet and their acid reflux would be gone. And it would be like, oh, but ginger's supposed to help acid reflux. Or they would come up with peaches as a food and then they'd eliminate peaches and their bloating would go away. And so that's the only test that I've personally seen time and time and time again produce reproducible results where I'm like, okay, like I could put money on this test, right? Like I could put money on that if you eliminate these foods that came up as positive, that you're going to feel better.
And you do it yearly. I like that because the 2 times I've done it, actually I've done several, but time period, there's a lot of time in between them. And they did come up with different foods. And like I said, multiple times I've been helped and relieved when eliminating those foods, at least for a period of time. So how often would we do them?
Let's say I'm a big fan of testing things and wellness and optimization. So I do it once a year for myself. If I were to be working with somebody on getting rid of their food sensitivities, which I've done and I love doing, is 3 months to 6 months is the soonest I would do it, where you would start seeing things shift.
Perfect.
Because you can absolutely get rid of those food sensitivities. And yeah, I mean, you could be sensitive to ginger and then you avoid it. And if you heal your gut, you're not gonna be sensitive to it anymore. And then the more foods that come up positive is like an indication that you have some reason why your gut is reacting to the foods you're eating. Oftentimes it's like the most common foods that we're eating. Part of that is not just to eliminate the foods. Part of it is like figure out why your gut is leaky. Maybe you're deficient in L-glutamine, and maybe you need some more bone broth in your diet. Maybe you could benefit from probiotics, or maybe it's like some kind of an infection, right?
Yeah. And do you believe that leaky gut is a thing? I often heard that if you have a ton of foods that's happening, intestinal permeability is likely a factor.
I believe that. Yeah, I do believe that. And like you said, berberine can be helpful for intestinal permeability. This is going to be a great way to help with that. I like colostrum as well. That can be helpful. Some of the lorazepam is a peptide that can be helpful for that, but also figuring out why it's leaky. So it could be SIBO that's causing your gut to be leaky. It could be L-glutamine deficiency or like a protozoal infection.
Okay. And 2 other tests that I often have used in my journey would be gut tests to find those bacterial imbalances, microbiome imbalances. And I think highly, and I've heard you mention the GI map, and then also oat tests. I loved in your book how you categorize, because there's so many different food reactions, right? And we'll talk about how you categorize them, but I loved the buildup, like your metabolite buildup category for like sulfur and salicylates and oxalates and histamine. These you kind of all put in one bucket, and I thought that was so genius. So would you do the oat test for that, or tell us 2 other tests that you think are high level helpful for most people?
Okay, so there's like the stool analysis tests that are going to be really great. And it could be like the GI map or the gut zoomer, and they'll look at markers like, do you have elevated zonulin? So does that show that's like leaky gut, right? Do you have low fecal elastase? That can be low pancreatic enzymes. What is your bacteria looking like? Do you have dysbiosis? Do you have H. pylori? Do you have protozoal infections? Do you have markers of inflammation in your gut? And this can really inform us on like what to do with that person. Well, let's say you've got this infection, then we're going to use this protocol. You've got elevated calprotectin. We're going to really do some anti-inflammatory herbs to help to bring down that inflammation, and that's going to help your diarrhea and digestive symptoms. And then there is the organic acid test. I love this test so much. I will say I've been running it for, I don't know, maybe 10 years, and I'm still learning new things about it every year. So it's not something that I recommend for patients to necessarily do on their own. it's something that you would want to work with a practitioner to interpret or like take a course on how to understand it. But this can show if you have candida in your system, because stool tests most likely will not. Candida can colonize you. It can show if you have mold colonization in your system. So if you've been mold exposed, you can have it in your home and then you leave your home, you burn down your house, you go live in an RV somewhere. But if it has colonized you, like that means you've become a mold machine, a mold factory. So that can reveal that. And then some of the correlations I've seen when people have candida and mold colonizations is they might have mitochondrial dysfunction, and this can mean their motility is going to be slowed, and they might need more carnitine to move things along, for example.
Yeah.
Or they might have oxalate buildups, or they might have histamine issues or salicylate issues. The oat can show salicylate issues and oxalate issues really well. And then we get into the situation of people who are eating a carnivore diet. What's going on? Why can't their bodies break down plant foods? And is it dysbiosis, or is it like oxalate issues? Is it histamine issues? Is it salicylate issues? A lot of them can be seen on the organic acid test. And once we see this pathway is off, then we can do something about it. So I've had people, let's say they have salicylate issues, and these are, like cherries and a lot of plant foods can cause symptoms in individuals, for anywhere from IBS to ADHD to allergy-like symptoms. We can move that pathway with something like glycine, right? And we can really help a person become asymptomatic and be able to tolerate more foods. Or oxalates, we can move the oxalate pathways with P5P, so then you're no longer that sensitive to oxalates, and clearing the candida or mold can actually give you an opportunity or allow you to eat oxalates without reacting to them, because you don't have that internal burden of oxalates, so your body has enough of the metabolic cofactors to move them along. Does that make sense?
Is that your stance too with carnivore, that is maybe like a temporary removal of problematic foods, or that, maybe we should go in and try to identify the imbalance that is preventing the proper digestion? Or do you think some people might just benefit from long-term carnivore because maybe their genetic ancestors, maybe they had a higher, and like maybe they're Inuits or Eskimos, what is your thoughts on that?
I think it could be both. I think it could be definitely genetic predisposition. So if you have these genes that are really optimized, with certain foods, that can be it. And it could also be you can have infections or some kind of metabolic buildups in your gut that are preventing you from properly digesting foods. And I feel like it's worth it exploring if it is the latter, right? So if you are somebody that's like on carnivore and still symptomatic or suffering, or you feel like, oh my gosh, I can't do this anymore, then that might be an indication to, hey, let's do an organic acid test and figure out why you're so sensitive to a lot of things. My goal for people is to live their best life and thrive, right?
Yeah, and I see so many carnivores too who just are loving it. Just like it is really working for them. And I think for them, yeah, okay. Like you said, if you're asymptomatic and you're enjoying the lifestyle and, you're tracking your progress, yeah, yay for you. I think that's a wonderful end result too. Okay, so I want to dive into a little bit more about the food piece too. So because you said, I can't remember the figure, but it was a lot. It was like 80% of people you've worked with or you like looked at, said food was sort of trigger. So what are the most common foods you find in like the population you work with that are causing issues? I know gluten and dairy. Are there others? And then describe the different types of reactions we might have to food and how we would know whether it was like an IgE, true allergy. I know you hate that term, but true allergy, or like a hypersensitivity, or actually an enzyme deficiency. Can you just talk about those two things?
Yeah, there's a lot of different foods, and for everybody it can be different. That's why there's not like a standard IBS diet, and gluten could be 25% of the time. It could be celiac disease or just gluten sensitivity. Gluten is a high nickel food, so that's another type of reaction that people might have. Gluten also can liberate histamine. Wheat is a high FODMAP food. And so there's like just so many reasons why a person might react to that, where it makes sense to get rid of that food. Dairy has whey protein and casein protein, which can be reactive, and also has lactose. A lot of times when we have an impaired digestive system, we're going to have trouble digesting lactose. Then we're looking at eggs as a potential culprit. For some people, grains might be an issue. For other people, these high fatty foods, and again, that oftentimes has to do more with your digestive capabilities versus like anything else. And then raw vegetables. So a lot of times I'll see people like struggling with lettuce, like lettuce gives them IBS or blueberries, and it like doesn't make sense to people that are carnivores. They're like, yes, I knew it. But to some people that might not make a lot of sense. And this is usually related to your ability to your dysbiosis and whatever stuff you've got going on in your microbiome. The foods that I feel like I would recommend for people to be off of would be highly processed foods and foods that have additives, artificial sweeteners, sugar alcohols. So again, like aspartame, sucralose, carrageenan, guar gum, sorbitol, erythritol. These can actually just cause diarrhea and gut damage and dysbiosis in many people. I know a lot of like, I love the keto diet. I like that's the diet that I feel best on. Like the keto snacks, a lot of times they're sweetened with erythritol, right? And this can be a really big trigger for some people. My husband had inflammatory bowel disease, ulcerative colitis, and erythritol was like a really big trigger for him because he was eating these Costco keto snacks, right?
Whoops, yeah. I could see that. I remember that in your book. And so how you might go about obviously IgE, like if you have a true allergy, that's like immediate, maybe potentially life-threatening response. You're going to feel that, right? But if
You would kind of know. You would
would
kind of
know.
know if you had that. Like, you have like a shellfish allergy or something. Like most
Yes.
people do know that, and you can do the testing for that with an allergist, immunologist. I think where people get in trouble is they try to figure out what their reactions are to foods, and they'll go down the allergist immunologist route. They'll be like, well, you don't really have anything. And they think that's like the end of the story, where the IgG testing is more of that functional medicine. And it's a different branch of the immune system. They are like delayed reactions that might take anywhere from minutes to like 4 days to show up in your system. You might have like brain fog, you might have fatigue, skin breakouts, bloating, irritable bowel syndrome, acid reflux, pain in your body from these foods, versus like a true allergy, which is, again, the IgE allergy. This would be like you have hives and you can't breathe. You might need an EpiPen. You might need to go to an emergency room.
And that was like, I remember when I first went in to kind of investigate, and I had the skin prick test, and it didn't find much. It was like grass. Okay, well, I have a grass thing. It did find soy, which I think I'm genuinely allergic to. But yeah, like you said. And then you talked about diets too, like FODMAP. You kind of thought the FODMAP diet was overrated. So what do you think if someone was, I mean, obviously looking at your individual food triggers, but what are the diets you found in your practice are most impactful and helpful if people didn't want to just like eliminate those top 5 foods? Do you find any of them helpful?
I'll say if you can eat home cooked foods or like a low processed diet or low additive diet, that's going to be really helpful for your IBS symptoms. Looking at all the research and the data out there, it's like it doesn't have to be like perfect and organic, but ideally if you could have like grass-fed meat and organic foods, I feel like a paleo-like diet can be very helpful for a lot of people's digestive issues. Grains are going to be more challenging for a lot of people to digest, especially in the early stages of trying to heal themselves. So like a paleo-like template can work really well, or a Mediterranean-like template can work really well. Of course, I always encourage people, like, you are your own person. And so you might need to make some adjustments there for yourself, right?
Yeah, and what about this nickel? Talk about nickel sensitivity. I think how would we know nickel sensitivity might be one of our root causes?
Well, if, like you said, if you're somebody that can't, people are like, you're so high maintenance, you get a rash from like this, like,
Fake
awful
jewelry.
fake jewelry, right? Like that would be a sign that this might be happening in your gut as well. And so you might be reacting to high nickel foods. Wheat is one example. Also, like your cutlery, which is like kind of crazy because you might have to switch some things around to really heal that.
Yeah, and I was thinking my sister, she reacts to like tea and chocolate and gluten. So I was like, oh my gosh, I wonder if this has always been a nickel thing, things that just didn't make a lot of sense. Okay, so last two questions, and then you'll tell us about your book, is if you optimize your digestion, right? If you start at the top and you improve your stomach acid and you improve your digestive output and you make sure that your bile acids are working properly, you're taking bitters before meals, you could probably get rid of a lot of food reactions. So is there someplace people would start? What supplements do you feel are the most impactful? What are the practices that you use around your meals?
So definitely getting into like a parasympathetic state. So making sure that you're nice and relaxed and you can say a prayer, some intentions, take some deep breaths. That's going to really get your digestive juices flowing. I love to use broad spectrum digestive enzymes to support the digestive process. People can also use herbal bitters. Outside of that, chewing your food, of course, is really important. But outside of that, there are some strategies you can take on to reduce your food sensitivities, like systemic enzymes, which are taken on an empty stomach, can be really great for breaking down those IgG food reactions.
Talk about that, circulating immune complexes. I love this part of your book.
Yeah, so what can happen is that your body forms these your immune system forms these complexes that recognize foods, also parts of your body, as targets for an attack or a reaction, and systemic enzymes help to break those apart. And so I will see people getting rid of their food sensitivities and getting rid of like thyroid antibodies, rheumatoid arthritis symptoms, a lot of joint pains, with a lot of inflammation, actually, a lot of biofilm with using systemic enzymes. So I love to utilize those for most people. Butyrate can be helpful for supporting our gut bacteria and for helping us digest our food better. It does smell like rotten butter, so that is something to consider, but it is really great for reducing food sensitivities and food reactions. Ginger, if you're not sensitive to it, that can be helpful for reducing food reactions as well. I have found, anything that helps to support the gut lining, like berberine or colostrum, can also help with that.
Yeah, and there's always, this is just such a emerging field, postbiotics, symbiotics. A million different types of probiotics. Is there anything, and this is another thing, the handheld SIBO meter, like what's new, hot, and happening in the space that you think has a lot of potential to help people?
Well, I think some of the peptides can be helpful. I think lorazepam can be helpful. It is had been studied for intestinal permeability. You could now get that from compounding pharmacies. That can be great for healing the gut and reducing food sensitivities. There's also some like oldies but goodies. So cromolyn can be compounded by compounding pharmacies, and that could reduce a lot of food sensitivities and food reactions that you can take. I like to use molybdenum for sulfur intolerance and for egg sensitivities. That can work quite well. I have found carnitine and alfalfa can help get rid of dairy sensitivity for many individuals. So there's some cool stuff out there that I didn't know about 10 plus years ago, and I'm excited to get it out.
Yeah, and we have like twins living with us at this point, and they were on regular cow milk dairy, and then they moved to goat milk dairy, neither of which worked really well. And now we're taking them off dairy. But after reading your book, I'm like, I forgot about camel milk. And the fact that some people who can't do dairy do tolerate camel milk because the types of proteins are different. Yes?
Yeah, that's been an interesting food that can help heal food sensitivities. There's some interesting research on that. I first came across it at like the Autism 1 conference, and a lot of kids with autism had casein sensitivities and casein issues, and they were using the camel milk as like a great source of, protein, and also it can stabilize the immune system and help people get rid of various sensitivities. So that's been fascinating. The protein structure is different. There is a formula recipe that I can send you for making camel milk formula. I have not used it, but a wonderful nutritionist from Colorado actually developed it.
No, yes, definitely send me that. Okay. And you're such a wealth of information. So you are pro peptides. All peptides, or just these peptides specifically for digestion?
I feel like if you can find ones that work for you and your system, that would be, again, it's like the right person for the right thing.
Okay, last question. Isabella, tell us where we can connect with you and where we can find this book. And then because you're, so knowledgeable about supplements and medications, I want to know, last question, what are you taking? What are you taking? What's your goal? Is it digestive health these days? Is it anti-aging? Like, what are you working with? And then, yeah, tell everybody where they can get this book. Because like I said, this was scratching the surface, to say the least. This book is jam-packed with very practical protocols and recommendations, and I absolutely loved it. But tell us what you're working with.
So thyroidpharmacist.com, and my book can be found on Amazon and everywhere that fine books are sold. I have a website. I already talked about that. I'm on social media, Isabella Wentz PharmD. I have a podcast where I just came out with an episode with Autumn, Thyroid Pharmacist Healing Conversations.
Yay, which I loved. We had so much fun.
We had so much fun. So I am recently postpartum. I had a baby less than 6 months ago, so I'm really, really working on my brain health. I also had some postpartum OCD, so I'm focusing there. I am taking PEA, which is a great brain support anti-inflammatory. I'm taking saffron.
Okay. Yes. PEA is kind of like the bliss, like kind of like a precursor. Is it related to anandamide? Am I making that up?
Yeah, you're correct. So it's like a natural cannabinoid, internal cannabinoid. I am taking fish oils because my brain definitely needs some repair. And I am taking nutritional lithium, and I'm also taking choline, phosphatidylcholine. So really, really trying to support my brain health, like trying to get that to be, as we know, pregnancy and postpartum can really deplete our brains. So I'm trying to get that back. I'm 43, so I'm not a spring chicken. And
you look like one, and you sound like one.
So that's my current stack, but it has ranged in all kinds of different supplements over the years, depending on what goals I had.
Okay, well, thank you, Isabella. Like I said, we could talk for a long time about all the different protocols at all the different stages of life, and hopefully we'll get the opportunity to. Do you have any famous last words of wisdom? Anything you think that we missed that's a really interesting topic around IBS that you think would help people?
I think there are just so many connections to different symptoms in your gut, and so I encourage people to explore the gut connection whenever they're struggling with anything.
Okay, thank you so much, Isabella. This has been such a pleasure.
Thank you so much for having me.